Welcome to the Med Show. I'm Dr. Shadi Al-Bahri, your host today. At the Med Show, we dive into the stories, research, and expertise of extraordinary people in medicine, entrepreneurship, and dentistry. Our mission is to help you become more informed and a sharper critical thinker. Today, we welcome Dr. Shadi Al-Bahri, an American board-certified general and hernia surgeon, and an assistant professor at UAE. Thank you for coming on our show today.
Thank you for having me, Dr. Rami.
So let's just break the ice and tell everybody that we are brothers. We share the same last name. So can you...
Except that I pronounce it Al-Bahri. That's how it's supposed to be said. Okay.
Yes, that is true. All right, tell me a little bit about yourself.
Well, first of all, I want to thank you for having me on the show. This is really great. I've been very excited about it and been hearing so much about it from you, but also the hype is picking up. So
yeah,
I'm excited that I'm on episode 3. So
yes,
good
and
enough.
you are the first one in medicine.
Excellent.
Yeah.
Excellent. That's great. So yeah, thanks for having me.
So tell me a little bit about yourself.
Oh, about myself. Thought we were avoiding that topic. So, well, as I'm sure you know, we were both born in Al Ain. Al Ain is a wonderful city in the United Arab Emirates. We're both of Syrian descent. But we grew up in Al Ain, and after that, after finishing high school, we went to the same school for 14 years, my God. Great school, International School of Shuwaifat, actually. After that,
branch.
Al Ain branch. if you want to add that, sure. After that, went to college at the University of Toronto in Canada, and that was a great experience. That's where I did my pre-med. It was a 4-year program, biology and statistics double major. After that, I applied for medical school, and the rest is history. But how do you want to start?
So now you're a surgeon.
Correct.
So, and a board certified one. Having graduated from the States or doing a residency in the States doesn't necessarily make you board certified.
Correct.
So how does one become an American board certified surgeon?
Well, it's a long process. As you know, it's a multiple step process that involves many years. And that's why I keep telling my students, you don't want to count the number of years and number of months, etc. It's a long process that you have to accept. And you have to accept the fact that in these circumstances, you just got to deal with delayed gratification. So understand that it's a process that involves getting through medical school, and then after that, applying for residency, which is a whole different nightmare. General surgery is quite competitive, and once you get in, it's a 5 to 6 year program. After residency, you are entitled to take a board exam. So it's the American Board of Surgery. It's a 2-part examination, which involves a multiple choice exam and then followed by a oral examination.
Okay, so when you graduate residency, you become board eligible.
Board eligible.
Okay,
yeah, correct. You take the qualifying examination, which is a written exam. You pass that, and then you'd be eligible to take the certifying exam. The certifying exam is scary, to say the least. But it's an oral examination where you face several very senior surgeons, big names in the field, and you answer the questions. You get through that, and you get your board certification in surgery. Yep.
All right. Well, again, being that I'm your brother, I know a little bit about your background, and we went to the same school, and I knew that you wanted to be a surgeon at a young age. Right. And I remember a very vague story because I was, I think, the 6th grade of your first dissection in school. Tell me a little bit about that.
Well, you know, I think we're both lucky that we had a family member, our dad, who's in healthcare, and that allowed me to have early exposure to medicine and surgery specifically. So I was able to actually scrub in on several cases as early as 10th grade and assist with an appendectomy. I don't know how legit that was at the time, but you know, I saw a lot of cool procedures and I fell in love. And so me and my classmates would go to get live animals, and obviously with the appropriate anesthesia and setting, we would do dissections. and founded the first anatomy club in our school. And from there, just the passion lit up, and I just wanted to be an abdominal surgeon specifically, not anything else. It had to be abdominal surgery.
Wow, that young age.
Yeah, that young age.
That's insane. Okay, so you did mention that you did your undergrad at University of Toronto, and then you went to medical school,
right.
And then that transition from medical school into residency. I understand that there's a qualifying exam called the USMLE. Tell me a little bit about that.
Ooh. The USMLE, so it's basically the exam it's a multi-step exam. It's 3 steps that you need to take to actually allow you to get into residency. And so you have to take the first 2 steps before you enter residency. It basically stands for the United States Medical Licensing Exam. And the first one is more heavily towards basic science. The second one becomes more clinical based after you complete your medical rotations in the different subspecialties.
But you're still in medical school?
You're still in medical school.
Okay.
You pass those 2, you're able to apply to residency based on how well you do in those exams. And that's one of the factors that residency programs take as they review your application. There are many other things that they look for. That ranges from what you've done in terms of extracurricular activities, volunteer work, if you've been involved in leadership positions in the university as a medical student, have you been involved in any research projects? Do the people that you're applying to know you? Have you rotated with them? Have you done electives with them, etc.? So those are all factors that help build your application, makes it stronger before you apply. So it's not all academia, and that plays a major role.
Well, that brings me to another question, maybe related, maybe unrelated. There's a recent study that came out that said that gamers have a 62% advantage in becoming a better surgeon. Did you see that article?
I did. I mean,
so maybe that should be in the application process. What's your rank in Call of Duty?
You and my brother are a whole different level. I mean, I wouldn't consider myself a pro gamer, but I did enjoy my video games, and it does play a role.
So really, do you think that will make you a better surgeon? At least the new generations.
It makes you a better surgeon when it comes to the advanced technologies that are coming out. So, we'll talk a little bit about laparoscopy and robotic surgery. And in that sense, yes, because you're literally working somewhere, but you're looking at a video screen and you're watching what you do while your hands are doing something else. And so that hand-eye coordination is what is basically improved with your video gaming skills.
Right. And also reaction time.
Correct.
Reaction time is very...
So I can tell you, my colleagues who were a little older, who never had that exposure, they're a lot, I'm sorry to say this, slower when it comes to reaction and picking up the new technologies and advancing into complex procedures, yeah.
Right. Okay, so now that you've done your USMLE, I heard now it's pass-fail?
It is.
Okay.
It is, yeah.
Do you think now it's a little bit harder? Being that it's pass-fail, you need to kind of differentiate yourself in other ways.
Correct, yeah. I think the pass-fail thing really made it more difficult, especially for foreign medical graduates, to really differentiate themselves, because as you might know, a large pool of the applicants are foreign medical graduates, meaning they've graduated from medical schools outside of the United States. And so traditionally it's been used to really show a significant advantage for those who score really high. But when it's pass-fail, like you said, you got to find other ways to differentiate yourself.
Right. Okay, so then now that you finish your part 1, part 2, and then you move on to residency, or at least you apply to residency, and then hopefully there's match day. Do you know that Harvard does like a match day event where everybody just... Tell us a little bit about match day.
Well, if I remember correctly, it was the same as St. Patrick's Day, isn't it?
Okay,
it's usually
fitting.
It's usually like a party week, but for most of us, it's actually a very stressful week.
Oh,
yeah. The days that lead up to, or the months that lead up to it, start off by sending in your application around September, the year before, and that year is filled with hopefully interviews for the applicant. Some of us aren't as lucky to get many interviews, because depending on how competitive the residency that you're applying for is. So you go through your interview process, and based on your preferences and based on what you think your chances are You kind of create a rank list before you submit it, and you submit your rank list, and programs also submit their rank list for the interviewees that they've interviewed, and you have a rank list here and a rank list here, and that's what a match happens. And so
you must like them and they must like you.
Correct. And it's scary because you don't know who likes you and who doesn't. And it's a rule that no program director that interviews you should give you any hint as to whether they like you or not.
But do they? Some do.
Some do. Yeah, if you're one of the lucky ones that got a hint.
Yeah.
I got that during my fellowship, but not during residency. Yeah.
Nice.
Well, during residency too.
All right, so now that you got into residency, and surgical residency is notorious, and I think what makes it very notorious is all the shows that are surrounded by it. You got Grey's Anatomy, you got The Resident, you got Dr. House, you got literally. I think it's such a fascinating field, especially the training aspect, especially in the US, that they were able to create all these shows.
Sure.
So is it a reality?
Well, of course, there's a lot of, what do they call it, like spices added on to these shows to make it more interesting. But a lot of it is true, and a lot of it is as dramatic as it seems. From some of the cases, I mean, a lot of those cases were actually filmed at the institution where I trained, and some of the other institutions around them, including Hopkins in Baltimore. I mean, a lot of those cases actually I knew about or I was involved in before. Like I remember there was that multiple transplant episode where there's like one being harvested, the other one gets it, and then the other one gets it, and it's like a whole circle. And yeah, that was done there, and many others. Now the working hours are definitely true, and how overworked residents are. I mean, it's 80 hours a week, and it gets pretty hectic. And it's not like 80 chill hours. It could go higher but you make up for it the week after. You know what I mean? But generally speaking, you have one golden weekend per month, meaning one actual real weekend that normal humans have. The rest are all you're working on the weekends. So it gets pretty tough. It gets hard. And but I can tell you at the time it was miserable, I can say, but now looking back, it really was some of the best times of my life. Just because you get that camaraderie that you get in the army, or I don't know what it is, but you're just stuck with these people in the trenches and you're suffering with them.
Especially it's a small program.
Small program, and for years. And it's not like a few months, whatever. No, it's years. And so they become family to you, right. And I can't see myself getting through it without those colleagues. Right. I mean, the support system is required to survive a residency, especially a surgery residency.
Well, we all saw how intense residency could be, especially a surgical residency. And do you think that way, because obviously the way that surgeons are trained in the US are unlike anywhere else in the world, and then that's what makes US trained doctors in general so talented. Do you think it's because of that stress, or do you think that's unnecessary stress? Do you think that made you a better surgeon, being in those trenches, literally?
Yeah. I've got to say, I have nothing against programs from all over the world. I know a lot of colleagues, and I know specifically a lot of programs all over the world that are fantastic programs. It's not that these programs are weaker. It's just that the US programs have a more organized setup, a conditions that ensure that all residents get adequate training, and it's very well monitored. So it's rare to have a resident get through the whole process and be a poor clinician. You know what I'm saying? So like
standardized.
Yeah, standardized. So I know fantastic surgeons from South America, from Africa, from Europe, from the Middle East. They're amazing surgeons. But that's because they also put a lot of themselves into it. They made sure that they were there for every case. They made sure that they were prepared for every case. But then their co-resident might have been terrible. You know what I mean? And that person slid through the whole process. Whereas that should not happen in a well-defined program in the U.S. And that's why ACGME accreditation, other accreditation programs like what we have now in the Emirates, the NIHS, fantastic. We're really improving residency programs to make sure that we have standardized ways of assessing these residents throughout the residency and making sure we're training qualified physicians.
Yeah, no, absolutely.
Yeah.
All right, so after you finished your 6-year residency program, you decided to get some further training. Tell me a little bit about that.
Well, as you can imagine, I mean, you want something to set you apart from the pack. You cannot just, for the most part, be unique with just being a general surgeon, unfortunately. The market these days, as difficult as it is, it's becoming more and more saturated, and you have to have some extra training to differentiate you from everyone else. Now, at the time of my training, most of my attending physicians, which are my trainers basically throughout residency, were traditional open surgeons. So the laparoscopic or video-assisted surgeries were limited to the less complex procedures. And so I wanted to get out there and do further training in more advanced, minimally invasive procedures.
Can you tell me a little bit about laparoscopic? Like, what is laparoscopy exactly?
So when I was saying laparoscopy is using a camera to get into the abdomen, you insufflate it with air, and you're able to look around and perform procedures through tiny holes that you put into the abdominal wall, and you put sticks in, and literally it's like 2 sticks that are in there, and you're just doing really fantastic things with just 2 tiny instruments.
And tiny incisions.
And tiny incisions, yeah, usually 5mm incisions. This is not new technology. I mean, this was around since the early 90s, but since then it was limited to less complex procedures such as in removing an appendix or removing a gallbladder. But it has progressed to doing amazing things, and I could spend all day talking about the different procedures you can do laparoscopically. But after laparoscopy, something even greater came up, which was robotic surgery. And robotic surgery is the other thing I trained in during my fellowship. It's basically telesurgery, meaning you're sitting down at a console, performing the operation in front of a screen, and utilizing your fingers into the machine, and the same sticks that I'm telling you about, except at the end of those sticks, they got full range of motion, just like your wrists do. And so any action that you do using your hands is translated into what the machine's doing in the abdomen. And that really opened up the floodgates to doing all kinds of complex procedures. Wow. And with a much better success rate, morbidity, mortality rate. Patients are getting out of the hospital at a much earlier time, less blood loss, less pain. So offers a lot of advantages.
As the name suggests, minimally invasive. Which benefits all.
Sure.
So when you're talking about robotics, do you think any AI will come into that?
Well, it already has. It's really blowing up. The thing is, has it really has it been applied to the day-to-day practice yet in terms of what we're doing? Not as much as I'd like to, but I expect within the next few years it's really going to change the way we practice. Already we use AI for predicting outcomes, for predicting complication rates for patients, for improving their recovery post-op, knowing how to adjust our protocol for certain patients versus others. So there's a lot that's coming out in research for AI, but in the community right now, it hasn't really affected our surgical practice yet.
Okay.
Yeah.
Okay. Well, I saw on the end of your name, you have FACS, which is a fellow of the American College of Surgeons. What is that exactly?
I don't have as many titles as you do, my friend.
I just collect.
This guy has like 4 titles now. Well, MD, as you know, is Doctor of Medicine, so that's what you get for just finishing a medical degree from Northern Hemisphere. And that's something I didn't know before. MBBS is different.
Yeah.
It's Bachelor of Medicine and Surgery,
Right.
whereas
We have the same
MD,
thing in dentistry as well, BDS. Yeah.
whereas for North America they do MD.
Right.
FACS is just a fellowship in the American College of Surgery. So it's different from being board certified. So if you're board certified, that's different. It's not even a title. You're just a
Diplomate.
Yeah, a diplomate of the American Board of Surgery. Whereas FACS is the American College of Surgeons is a what is it? Like association, right?
Society.
Yeah, exactly, society. And they require you to. They basically monitor your practice to see how your practice is, how much research you're doing, how your complication rates are, etc. And based on that, after several years, you're able to apply for a fellowship in the American College.
You have to give them like a logbook or something, or is it just an experience?
So
time has to pass by.
Time, a logbook, publications, and then an interview with the local chapter. So every country has a chapter for the American College. You meet with the local chapter, and they interview you. They assess your practice, and based on that, based on the recommendation of the president of the local chapter, you get inducted to the American College.
Amazing.
At the time, it was in the middle of COVID, so I didn't even get a chance to go for the convocation. One day I'll go.
yeah, I couldn't go to my Canadian one, the fellowship of the Royal College of Dentists in Canada. Yeah, couldn't go to that.